I'm going to talk about 405D HICP and a little educational session on that. Then I want to talk about preparing your organization for cyber insurance and how being on these frameworks such as NIST or 405D can help organizations move forward with their cyber insurance renewals and policies and make them better prepared. And then we'll have some time for questions. First Health Advisory, we're a consulting and managed services firm that focus in healthcare and life sciences. We have many services from BCSO to medical device security and other offerings to help organizations assess their security and privacy programs to ensure that they will have adequate performance, uptime, the ability to treat the patients that they care for, and ensure patient safety throughout all of their operations. And I am going to turn it over to Elvis to talk a little bit about, give us an update on what the FBI is seeing in threats in healthcare.
All right, well, thank you very much for the handoff. You can hear me okay?
We can.
Yeah, if you can go to the next slide. All right, so thank you all for having me today. My job is to just set the scene for you of what we are seeing in the FBI in terms of cyber threats impacting the healthcare sector. Before I jump into the top threats for this year, I really just want to do some level setting and let you know what we see as a threat continuum within the U.S. intelligence community. So if we start on the left, you can see there are hacktivists. These are politically or ideologically motivated hackers. They do data destruction attacks. They do distributed denial of service attacks. They'll do website defacements. I think the most famous group you may have heard of is Anonymous. We did a big takedown about 10 years ago, and they seem to be popping up again these days, but they seem to be targeting Russian government organizations as opposed to American organizations. Next on the list is financially motivated crime. This is the bread and butter of what the FBI works every day. Approximately 60% of our cyber investigations are focused on financially motivated crime. So ransomware attacks, business email compromises, all of the different types of cyber-enabled crime that you can think of, the FBI investigates. And I'm going to dive into that a little bit more closely when we talk about what the top threats are for this year. Next on the list is insider threats. So for those of you not familiar with this term, it's individuals who are either employees, vendors, contractors, other individuals who may have access to your computer networks. And typically insider threats will steal proprietary information for some sort of gain, whether it be financial gain or personal gain, or just personal gain to make money. Next on the list is economic espionage actors. So this is different from your typical insider threat. Economic espionage is a term of art within the FBI. It implies someone who is backed by a foreign nation state. So as you can imagine, adversarial foreign nation states are always trying to steal intellectual property and PHI and PII from organizations. And so this is something that we work very heavily on here in the San Francisco office. Next on the continuum are cyber terrorism threats. I would say, for those of you not familiar, cyber terrorism is also a term of art, and it implies that there is a terrorist organization like ISIS, Al-Qaeda, most recently Hamas, terrorist organizations who are trying to conduct some sort of computer network operations against individuals or organizations. So I think the good news that I can share with you on this threat continuum is that we don't assess any of these terrorist groups that I mentioned have the capability of opening up the floodgates on a dam or knocking out the power grid in Santa Clara County. It's not that they don't have the intent or motivation. It's that right now we don't believe they have the technical capability of it. What we've seen over the weekend, specifically with Hamas targeting Israel, is we've seen some limited distributed denial of service attacks, some limited data destruction attacks, but nothing that a sophisticated country, that's tech savvy as Israel can't handle. And then last but not least on this continuum is cyber warfare. So cyber warfare implies nation against nation. And I think the best example that we have of that right now is the Russian invasion of Ukraine. So before Russian tanks started rolling across the border, we saw a lot of cyber weaponry being tossed across the border against Ukrainian critical infrastructure. So the same kinds of things that I said Hamas was doing against Israel, the Russians were doing against the Ukrainians, but at a much larger scale. Data erasure attacks, distributed denial of service attacks, and then heavy cyber espionage to try to collect intelligence. As you can imagine, a nation state with the resources of Russia, very capable. And even though the Ukrainians have been very resilient, it's a daily battle just to keep the lights on in Ukraine, to keep the internet working, because there's, satellite internet that's being used primarily right now, and just telecommunications channels open. So that just sets the stage for what I'm going to talk about on the next slide. Oop, okay, we can just skip the legal disclaimer for now. Somehow that got flipped around. All right, so the top 3 threats that I see facing the nation and really is targeting the healthcare sector are ransomware attacks, business email compromise, and supply chain attacks. And so I'll dive into that a little bit deeper on the next slide. So for those of you not familiar with ransomware, it typically comes through an email or a text, and there's an attachment or a link. Once that attachment or link is clicked on, it will execute malicious software, malware, and it's going to go onto your device or onto your computer network, and it's going to do 2 things. Number 1, it's going to slowly and quietly export all of the sensitive data from the device or servers that it can find. And then after that, it's going to lock it up. It's going to encrypt it. And then it's going to send the CISO, the C-suite, ransom letter, and it's going to ask for 2 ransoms. The first ransom is going to be, hey, we stole all of your data. If you want us to delete the data, you have to pay us a first ransom. And then the second ransom is going to be, hey, I think you've noticed that we've locked up all of your servers. If you want to unlock them, you will have to pay us a second ransom to get the keys. And so this is a big trend. And if you look at the next slide, you will see that the number 1 sector that the FBI sees being targeted by ransomware actors is the healthcare and public health sector. And so I think that comes as no surprise to you, right? So healthcare sector, your number 1 job is to help people and their health, right? And so unfortunately, information technology, information security, a lot of times is under-resourced, not properly staffed. I'm sure, Will has had experiences with that. I mean, that's why they have their, consulting firm, right? And so I think one of the big issues that I've been seeing is that, especially during COVID and post-COVID, people are just trying to keep the lights on and keep the patients alive. So trying to also make sure that they have good cybersecurity has just been another thing that they have to worry about, and it's been a lot. And I know Will and I, we're going to talk about prevention and guidelines after that. If you can go to the next slide. Yeah, so the next thing I want to talk about isn't really that sophisticated at all in terms of technology, but in terms of social engineering, it's really one of the things that we continue to worry about. It's called business email compromise, and maybe you don't know what that term means, but I'm sure you know what it is. It also comes in the form of an email or a text, and it's trying to convince you to do something. There's not necessarily a link or an attachment in it, but what it's usually trying to convince you to do is wire money to a bank account that you think is being controlled by a vendor or a contractor or a supplier, but it's actually being controlled by a bad guy. And so if you look at all of the reported losses, we have just seen it continue to grow. Last year was the most reported losses to the FBI, $2.8 billion. We estimate that only 1 in 5 victims actually reports to the FBI. So if you multiply that loss number by 5, you probably get a more accurate reading of the amount of loss, about $14 billion worth of financial loss just from this kind of scam. I'm going to let you know the FBI cannot investigate its way out of this problem. So what we've developed developed is this thing called the Financial Fraud Kill Chain. And if you go to ic3.gov, and if your organization has been the victim of this type of scam, then you can, submit a financial fraud kill chain. It'll just ask for all of like the financial information, like your routing numbers, recipient bank account numbers, that sort of thing. And we have analysts working 24 hours a day, 7 days a week, who can actually work with the banks to freeze that money and claw it back. Last year, when we had reports provided to us, within 48 hours of the money being wired out, we had a 72% success rate of clawing it back. And so the minimum amount for that is $10,000, but I know with a lot of healthcare organizations, they're dealing with much larger numbers than that. And if you go to the next slide. Yeah, so this just gives you some details about it. Want to foot stomp ic3.gov. It stands for Internet Crime Complaint Center. And you can actually use that website for any cybercrime that you want to report to the FBI. If you go to the next slide, Will. Okay, the last threat I want to talk about is supply chain attacks, because this is a very insidious type of attack. So supply chain, what I'm looking at as a supply chain are like, what are all of the hardware appliances? What is all the software that your organization uses? All of those are in your supply chain, right? So think of all the software applications that a healthcare organization uses. Think of all the hardware that you have that's using, the CAT scan equipment, X-ray equipment, all of that is likely internet enabled now. And so there's all of the software and firmware that you have to deal with. Guess what? Bad guys will find vulnerabilities in all of the software and firmware and will exploit it. And so I've just listed some of the big supply chain attacks. SolarWinds was a software company. Russian government figured out how to get into their patching process and were able to circumvent that. Hafnium, Chinese government was able to figure out a vulnerability in Microsoft Exchange server software and exploit that. Cyclops Blink was supply chain attack that was impacting 2 brands of American firewall appliances. And then most recently was MoveIt, right? A data transfer software that a lot of people use, and it was being used to inject ransomware. So these are like the big these are the big attacks that I really see facing the healthcare sector today. If you go to the next slide. And then, one more. So the emerging threat, I'm sure we're going to talk about it a little bit more, is artificial intelligence, specifically generative artificial intelligence. So we are already seeing that within the FBI, how criminals are trying to use generative AI to impact the top 3 threats that I've already seen. So as you can imagine, like the chatbots these days are getting really good. They sound like actual people, right? And so guess what? Bad guys are using them to craft messages that don't have the same English grammar mistakes that will help you detect that this is fake, right? So that's one thing we've seen. We've also seen voice cloning, where someone will pretend to be your CEO or, an executive. And guess what? They can just go to YouTube or wherever and find all of these, recordings of them and siphon their voice and then clone it. So those are like the top 2 artificial intelligence threats that I've seen. This last slide that I have before I hand it off to Will, if you want to take a screenshot of that, is these are just really some helpful resources for you as you want to provide cybersecurity training to your organization. So I'll hand it back to Will at this point.
Thank you very much, Elvis. Sounds good. And you mentioned some important advice there. We're seeing some of the same things in healthcare with the threats, and we'll talk about that a little bit more. And I'll ask. We'll have some time for questions at the end. Well, we're not going to be using up the whole hour today, and as we go along, I'll ask Elvis to step in and comment on some of the threats or protection items that I may be talking about as we go. So how do we protect against these threats that Elvis talked about and many others? And that starts with a cyber program and a maturity, building the maturity of a cyber program. And one of the best ways to do that is to implement a framework.